My name is Lena Njoku. I am the Health Professions Director over at UC Irvine for UC Prime Pre-Health Pathways. We are a grant-funded program, a pre-health office with a mission. So this is a new program on campus. As Tuan mentioned, I've had a long career in health professions, and I am fortunate enough to, within the last year, have started this position as the director of UC Prime Pre-Health Pathways. This program is a pre-health office with a mission for advancing equity in the health professions. Before we get into the general health professions overview, I'd like to share a little bit about the program that I currently work for, in case there are any community college students at this time that are interested in matriculating to UCI one day. And then also to encourage you that if you matriculate to any other universities to find similar support programs to help you progress through the health professions. So as I mentioned, I'm going to introduce the UC Prime Pre-Health Pathways or UC3 program first. Then I'm going to talk a little bit about introducing the health professions overall, meaning the exploration stage, the preparation stage, and a little bit of additional info. So before we get into the overview of before we get into the overview of health professions, I want to talk about the UC Prime Pre-Health Pathways program. As I mentioned, we are a new program on the campus of UCI. So before this program came to campus, there's no pre-health advising office. They just had kind of advising within the biosciences. So the objective of this program was to present an opportunity for students that are marginalized, first generation, low income, to really get that support in exploring the health professions, but also understanding what it means to be a competitive applicant. So I'll talk a little bit about our structure and then go into health professions. Wanted to share with you introduce you to our leadership team. UC Prime Pre-Health Pathways was pioneered by Dr. John Billimek. He's an associate professor and co-director of Prime LC at the UCI School of Medicine. And Dr. Belinda Campos is the chair of the Chicano Latino Studies Department in the School of Social Sciences on the campus of UCI. So this program is actually a marriage between the School of Medicine and the School of Social Sciences with that mission of opening doors for marginalized and first generation students in the health professions. Along with myself as the director, and we have two coordinators. I'm really proud of our team because all of us are representative of those groups that we do want to assist through the health professions pipeline. So first generation marginalized, low income, we represent those students that this program is really trying to uplift and empower. Speaking of upliftment and empowerment, our mission is to cultivate a diverse and inclusive community of future healthcare leaders who are equipped with knowledge, support, and opportunities needed to excel in the health professions. Wanted to show you a picture of Prime mentors. So we do have different cohorts. And again, our mission really is to cultivate a diverse and inclusive community environment for students to be successful so that we can advance equity within the health professions. A little bit about how we do that is we utilize cohorts. So each year, UC3P accepts cohorts of students. So each year, we're taking 25 Prime Scholars, 6 Prime Fellows, and 6 Prime Mentors. And we have a cascading mentorship model in which the mentors and the fellows are really creating community and building support programs and research with those Prime Scholars. So that's just a little bit of an overview of UC3P. Now, I would like to get into health professions. So, this is what you all came here for, just a little bit of an overview about the health professions. I mentioned that I've been in health profession advising for over a decade, and I'm really passionate about students really understanding not just one way to go, but understanding health professions as a whole so that you can understand what direction that you'll go that works best for who you are and your values and your passions. So hopefully we can kind of get an understanding of that with this presentation today. So the first section of understanding the overview of health professions is the exploration stage. So I have a quote here from Jeff Oxendine. He is a pioneer in helping students explore health professions. He wrote a book called You Don't Have to Be a Doctor, Discovering, Achieving, and Enjoying Your Authentic Healthcare Career. And a quote from him is that increasing exposure to health industry trends, career options, and professionals is essential to knowing what is possible for you and making well-informed choices about your authentic healthcare career. So for me, what that means is from the beginning, really understanding what does pre-health mean. That means anyone seeking admissions into a health professions program once they complete their bachelor's degree. And typically, pre-health students are actively seeking in and out of the classroom experiences to develop a well-rounded application. So some characteristics of health professionals is typically that you are a people person, generally. You are interested in or passionate about the sciences, and you are interested in and or passionate about this. So all of these three characteristics, as long as you have them, typically many of the health professions that we'll be talking about today may be a good fit for you. So staying open and aware and open to learning new things about different careers is key to finding your authentic healthcare career for yourself. So let's talk about some general health professions that we'll be discussing as we are talking generally about health professions. So there are your four-year doctoral programs. These are where many of you probably are interested in pursuing. So there's four-year doctoral programs, which is physician, MD, DO, dental, pharmacy, optometry, podiatry, veterinary medicine. And then there are three-year doctoral programs and master's programs, which is physical therapy, chiropractors, nursing, which can also be a doctoral program now, physician assistant, public health, and occupational therapy, which is also a doctoral option too. So we have these general health professions, which many of us know about, and many of you are probably pursuing. What I want you to do is also kind of consider other areas within healthcare that may be of interest to you. So let's talk about some non-clinical career paths. So we did mention public health. There's health management and policy, community health workers, navigators, social work. There's a blooming area of big data and analytics within healthcare, digital health, health information technology, consulting, and entrepreneurship. And then within public health, there are many areas that you can really serve from a cultural or societal lens, and that's health administration, health policy, community health, epidemiology and biostatistics, infectious diseases, maternal and child health, public health nutrition, environmental health. So these are a policy or public umbrella area in which students can work in healthcare. And then there is also behavioral health and behavioral health within clinic careers. So some of those are psychology, mental health counselors, licensed clinical social workers, psychiatrists, psych nurse practitioners, peer support specialists, substance use disorder counselors, behavioral health, wellness coaches, mental health specialists, and the psych specialties. So, if any of these seem interesting to you, but you've never heard of those careers, or you have heard something here or there about them and want to learn more, I highly encourage you to take note of explorehealthcareers.org. That is a great starting for understanding these different health careers, the different nuances between each one, and then also the similarities. So as I mentioned, there are the general patient care provider uh, programs and careers that many students know about, but I also encourage you to look into these other areas that healthcare and serve people in general. And that wider understanding and the understanding of yourself will help you find an authentic healthcare career for yourself. So, thinking about career alignment, I always encourage students to really do some self-reflection on what's your motivation in pursuing health careers. What do you find interesting about these health careers? And then where do your skill lie? So an honest assessment of what are your skills as it relates to health professions and the career that you want to pursue. And bringing back some information from Jeff Oxendine, this is really important to really understand why it's so important to understand the career that you're going into. Because if you really understand your own passion, values, goals, your mission, why are you interested in this? And then you also have a clear understanding for yourself. What are you good at? What do you enjoy? Where are your skills? And then you find a job, an opportunity, a career that is in line with your passion, values, goals, what you're good at, and then the needs of the healthcare employer that you're going into. That's when you can really find career alignment. And that's one thing that I really want to communicate with my students that are in the program is that what's more important than finding that, than pursuing, with blind enthusiasm that one healthcare career, really stepping back and analyzing your passion, values, and goals and what you're good at and making sure that that aligns with the career that you're seeking. And if it does, then you will find purpose. You will have fulfilling work. You will have impact. You will have financial reward. You will have satisfaction, health, and wellness. Oftentimes, if you go into a healthcare career that maybe you're good at and meets the goals, but you have no passion for, that's how you can get burnout. Or if you have passion and value and you know what you're good at and you're skilled at, but you don't quite know or have not found a career or an employer that meets those passions and values, then that's when you don't have alignment within your career satisfaction. So this is kind of a diagram that shows why it's important to really look at all of these factors when thinking about what is an authentic career for you to pursue. Okay. And then as we transition into this next phase of exploring healthcare careers, or I'm sorry, preparing for your healthcare career and making yourself pretty competitive to get into the application process, I wanted to talk a little bit about the different pathways that you may be taking to get to your healthcare career. So this is a lot on this slide, but I'll try and break it down so that you can understand some points that I think a lot of students aren't clear about. So hopefully you'll be clear about your kind of pathway options pursuing the health professions. So a lot of you are here in undergraduate completing your 4 to 6 years of your undergraduate education. Whether you're at CC and you're gonna transfer to your university, that may take between 4 to 6 years. But there you'll be getting your strong prerequisites, healthcare experience, research, exam scores, and more. And the traditional route that a lot of students know about is once you graduate from undergrad, you will be submitting applications, taking tests, preparing for an acceptance into a graduate program. So those students who are apply and are accepted into their graduate programs, typically for the doctoral programs that we talked about, the traditional doctoral programs that are traditional additional 4 years to get your degree. The first 2 years are typically those sciences again, and we'll talk about what those prerequisites are to prepare you for those first 2 years of sciences. And then you'll have a second 2 years of typically rotations, clinical experience, exposing you to the career in your graduate program. So that's typically what it is for medical, dental, and pharmacy school. Those are all four-year doctoral programs. Programs like PA school and a master's degree, they typically say that PAs do 80% of what physicians do, but it takes them 50% of the time, money, and energy to get there. And they have a little bit more lifestyle freedom, a little bit more specialty, flexibility, and freedom within this career choice. And PAs typically are taking 1 year for those sciences and then 1 to 2 years for the clinical rotations. A great kind of side note about PA is that within those specialties, you can actually switch your specialty in PAs once you've gotten into your career. But with the physician route, those specialties, so if you want to be a OBGYN or a dermatologist or a pediatrician, your specialty, you actually don't choose that till your third or fourth year of medical school. And whatever specialty you choose, that will be your specialty you practice in for the duration of your career. Which within PA, the alternative is you are able to go back and get to continued education and switch specialties. So, say if you go into your PA education and decide that you want to specialize in surgery as a PA, and you work in surgery and you see that it's pretty intense and requires a lot of your lifestyle, a PA can go back and get additional knowledge base and licensure and become a dermatology specialty within PA or a family practitioner within PA. So that's the great option with PA. They have a lot of flexibility within the lifestyle and actual career. Then after graduate school, so after you actually graduate from medical school or dental school or pharmacy school, or you get your master's, your PA master's degree, you're not actually just going into working your career. Typically, there is licensure to pass so that you can actually be a full um, practicing um, and the some of the programs like medical school, it does have a residency portion after graduating, and those are typically 1 to 4 years, depending on the program. So you are getting your experience so you can pass the boards for your particular specialty. Some pharmacy and dental programs have some type of residency or fellowships if you want to specialize. And then once you pass your boards, you get your licensure, then you go on into your career. So just wanted to kind of clarify and understanding the pathway to getting into a healthcare career for a lot of the clinical routes. And also want to talk about the alternative post-bac option. So post-bac programs can be a general term meaning any type of program, schooling, courses that you're taking after you. So these can be two different paths and two different programs that are both called post-bac programs. So there are career changer post-bac programs and academic record enhancer post-bac programs. Career changers are typically for students that don't have any prerequisites completed, but they have a bachelor's degree. And so they will look at career changer programs to just complete those prerequisite courses. And then you have post-bac programs that are for academic record enhancers and students who have completed all the prerequisite courses required for graduate programs, but they may just need to further show evidence of academic maturity via additional courses. So really, those are the two different post-bac program options. And if you don't have a strong enough GPA or a strong enough application after undergraduate, there is still an opportunity to strengthen your application and still apply to medical school or dental school or pharmacy school or any of these health profession programs. And if you did work through undergrad, but maybe were an academic late bloomer, maybe you didn't really figure out your study habits, study skills till later on in your undergraduate career, post-bac programs can really show that progress and that academic maturity through additional courses. So going into the preparation stage, education is the most powerful weapon which you can use to change the world. So we want to make sure that you guys are fully prepared to go into these health profession programs with well-rounded and competitive application. So what does it mean to be a competitive pre-health applicant? Well, in a nutshell, these are the kind of areas in which you should be strong when you're going into your application process. So, in general, you should have healthcare related experience. How do you know you want to be a physician, a pharmacist, a physical therapist, um, a any type of clinician, unless you've exposed yourself to the healthcare environment and you understand healthcare as a whole, you understand yourself, and you can kind of figure out what direction works best for you. Community service. So, healthcare providers are community servants. You should have some type of evidence of serving the community to show that evidence of your passion for people and service. Health professionals are also leaders in the community. So we want to see some type of leadership experience. You don't need to be the president of every club and organization, but you can show some type of um, uh, taking over of a project, a program, some type of example of a way that you can show leadership. Research is a way that medicine changes. So if you are applying to medical school, you do need to have research. Research is something that is very important, and it can give students a lot of experience and understanding into healthcare and how things change. If you're in any of the other health professions, if you're seeking pharmacy, dental, maybe master's in public health, these programs don't necessarily require research, but no matter what health program that you're interested in, research can be an asset to your application. Because having that experience and understanding the research process of asking a question and taking the steps to find the answer can be beneficial to you as a whole and make you a better, well-rounded candidate. Research does not have to be traditional wet lab research. Research can be social research where you're doing surveys and analyzing data. You can do clinical research in a hospital. It's okay if you do traditional bench research, but whatever you're doing, make sure that you're interested in the question that you're asking. So if you're not interested in fruit flies, and the questions that are being asked in those type of research labs, find an equity-based research lab that you're interested in. Find a childhood obesity research lab that you're interested in. Find a research lab that's asking a question that you are genuinely interested in finding the answer, and that will be the best type of research for you. Again, if you're pre-med, this is something that is required. But if you're pursuing any other health profession, I would highly encourage you to engage in some type of research because it will really help you understand healthcare from another lens. Letters of evaluation is what others think of you. So typically you will need two letters of recommendation from some type of faculty that have taught you that can speak to your experience as a student. Then you need letters of evaluation from those who can speak to you, to your character as an individual and or your potential to be a healthcare. So developing those networks and being aware of the networks that you will need going into the application process will be very important. So when you have those faculty that you are drawn to or very close to, or you feel that taught very well, make sure that you connect with them and then keep connections with them. Stay in contact with them because they may be really excited about writing a letter on your behalf for your graduate program, whatever that may be. Um, And then also, when you're in your volunteer opportunities, take note of relationships that may develop. Even if you are interested in PA and you develop a relationship with a nurse, or you're interested in occupational therapy and you develop a relationship with a physician, that would still be a great letter of recommendation because it's someone that can speak to your potential to become a healthcare provider. So that's what we're really looking for in that. Keep that in the back of your mind. Make sure you keep those networks. Make sure you keep in contact with individuals that you really resonate with, and start developing those mentorship kind of experiences so that you will have people that can speak to your potential. And then, of course, academic achievement. Academic achievement is really how the health profession programs will be able to see your likelihood of completing their program. So they want to see that you can be successful in the sciences. They want to see that you can be successful in their particular prerequisites so that they can see your likelihood of being successful in their program. So that academic achievement is very important. And then, of course, the gap or growth year, that we'll talk a little bit in a couple slides about the 10 reasons that a gap year or a growth year is definitely good. Gap years are more of the norm now. Students are almost expected to take time to really reflect on their application and take time to make sure that they do have a well-rounded application, and it's not just academics that they have to show for who they are. I'll go through this quickly. Many of you do have pre-health advising and do have a general understanding of the prerequisites, but I wanted to show here that no matter what health profession generally in the clinical sense wise you're interested in, a lot of times you can start your pre-health journey with taking general chem, general bio, general physics, and be on your way to a lot of different health professions. So wanted to encourage you that you don't have to choose, especially if in your first or second or third year, what health profession you want to go into. I really encourage you to get into your clinical experience before you really make that hard choice about what direction you want to go, to really shadow, volunteer, get that clinical experience in various healthcare environments, so that you can make a well-informed choice and decision on what direction you will take for your healthcare career. Just a little note on academics. So that impressive GPA and test scores can make up your first impression. So I want you guys to make sure that you do understand that the science GPA and your cumulative GPA is something that will be taken into consideration for your application. Trends in your academic record are also noticed. So, like I mentioned before, if you maybe had a rough start academically, showing that academic maturity over time can definitely give you that additional assistance you need in becoming a competitive applicant. A quick note on test prep. So I don't want anyone to underestimate the value of test prep programs. I find that especially my first generation, low income, marginalized students typically don't take advantage of these because of the costs. And there are a lot of opportunities for payment of these test prep programs. Always seek out assistance. But the value of these test prep programs is that it's in their best interest for you to do well. So they really are valuable in helping you understand test prep strategy, content, what you need to do well. Many students do try and just power through on their own. They figure that they've gone through these courses, general biophysics, on their own without hiring anyone to help them. But this is especially with the MCAT in particular, students that are pre-med, I highly encourage you to look into the test prep, and make sure that you are taking advantage of those so that you can do well and take that MCAT one time. that's something that a lot of students come in thinking it's like the SAT, where you take the first time as practice and then see how you do. And that's not what this is. This is a test that is 7 hours long. It's very expensive, a lot of time and energy, and it's something that you want to prepare to take one time. So you want to make sure that you gather your resources to prepare the most so that you can do the best that you can the first time. Some academic considerations is typically all attempts at your coursework is considered in applications, and typically AP and IB credit is not accepted for required coursework. And then, of course, excessive credit, no credit courses or incompletes or withdrawals can be negative. Just a heads up about standardized tests. So post-COVID, there are a lot of programs that are not requiring test scores, but those that do, here's a heads up about them. The graduate record exam is for some physician assistant programs, some occupational therapy programs, some physical therapy programs, some public health master's programs want to see it. And then the medical school admissions test, of course, is for med school. Some optometry programs want to see the OAT, but some will also take the GRE. Mostly pharmacy schools in California don't require the PCAT. And then same with dental schools, some do, some don't. But they do some that require tests will require the DAT or the dental admissions test. Centralized application service, just a note about this. When you do apply to your health profession program, most of them are you designate multiple institutions using a single set of application materials. So um, you don't have to be sending transcripts to 20 medical schools. You can send it just to one centralized application service, and they will disseminate it to all the schools you apply to. Some financial considerations in your preparation for your programs. Typically, there will be volunteer fees, background check fees, test prep fees, registration fees. And then in your application, there's initial application costs, supplemental application fees, and possibly travel costs for interviews. So for that, I want to give you a heads up that most test prep programs offer discounted courses to those that qualify. And then I also want to give you a heads up that most application services have a fee assistant programs that for those that qualify. And both, usually you need to apply for them ahead of time before even registering for your test or before even going into the application process. So if you know that you will need those, keep that in mind. Okay, and I want to talk a little bit about some resources and a timeline as you are preparing for your application. So at UC Irvine, we have a freshman seminar called, it's an introduction to health professions, but it's also really exploring and understanding, finding your authentic healthcare career. So we really go through understanding your own values and understanding a lot of different health careers and matching up your values with a authentic health career for yourself. So I encourage you all to, if at your respective institutions you have some type of introductory to health professions course, to look into it. Ours is only one unit, and it's an hour a week out of your quarter or semester. Those of you who are in your first year, I encourage you to really establish your academic foundation, attend seminars like this one. You're here, so that means you're already on top of it. Find a study group, making sure that you are not studying alone. I know it might seem competitive to be a pre-med or pre-health or pre-pharm student, but this is really a group effort to do well. So please make sure that you find a study group. The students that do well statistically study with others. So if you don't take anything today, please make sure you do find a study group Creating a tutoring schedule. So most universities, most institutions, most community college will have some type of tutoring center. The institutions want you to do well, so you have resources to take advantage of that you paid for with your tuition dollars. So typically you will have a tutoring center. Take advantage of them, go to them weekly. If you go to one tutor and don't align with them, find another one. Make sure with the especially general bio, general chem classes, you're doing study groups and tutoring sessions. And this is when you're establishing your academic foundation. Typically, within your second year, you're doing the same thing. You're establishing those good study habits, study skills, continuing those on. This is when you should be adding into your schedule, joining clubs and organizations, maybe attending pre-health conferences like this one, maybe getting into clinical or even research experience. This is when you should be getting your feet wet and understanding what's the hospital environment, what's the difference between a physician and a nurse, what do the PAs do versus a physical therapist? What do the occupational therapists do versus the pharmacists? Maybe looking at the hospital management, seeing that side of the house and what that looks like. So this is really your time to explore different health professions and then also reflecting and exploring on yourself. So what type of lifestyle do you want to live? What are your passion? What are your goals? Why are you interested in healthcare in the first place? Okay. And then third year, this is really when you're in your third and on, you're in your preparation phase, preparing for success. So you're preparing by continuing to attend seminar series, maybe joining a research lab. You should definitely be establishing your mentorship relationships. And then if you happen to be at UC Irvine, applying to be a prime scholar, and then you can kind of get all of this in our program. And if you end up at another four-year institution, finding some type of pre-health community to join. This is so health professions is a very interpersonal career that you're going into. So start getting into opportunities to really network with others that are pursuing the same goals as you are, and also research experience, clinical experience, preparing, understanding healthcare as a whole. Then in your fourth and fifth year, you can continue that research, mentorships, maybe even doing campus visits to healthcare programs that you're interested in. There's plenty of local programs that are consistently having open houses, info sessions, virtual and in person. So don't wait until you're right at your application cycle to take advantage of these information sessions, to take advantage of these campus open houses. Make sure to visit as many as possible before you even make your decision on what direction you want to go. And here you're really developing your profile as you prepare to apply. And then in your gap year, you're doing those same things and possibly applying. So wanted to give you guys a little bit of a timeline of what you should be doing and when. And then also just really encouraging all that, the gap year is the norm now. It gives you more time to study for those standardized exams. You can use that extra year if you need to solidify your GPA with additional sciences, securing stronger letters of recommendation by having long-term relationships and establishing those, getting financially in order. It's very expensive to apply, and even, in within these programs. So that gives you an opportunity to do that, maybe work. You have more time on focusing for preparation that's required to apply. Everyone else is doing it. It's so common. Very few students I am working with are applying their junior year because it's just a lot. And really, those students that are applying during their junior year, especially for medical school, are finding themselves at a disadvantage because they have less to really present at that medical school interview. They have less time to have talked about where their passions are, what they've done to really solidify that this is the route that they want to go. And it just gives you more time to gain more practical experience and be able to articulate your career interests. And then, as I mentioned before, it is hard for juniors to compete favorably with those who have had more life experience. Life is short, so health profession programs are intense, even more intense than anything you've ever experienced. So taking an additional year or two to really process that and prepare for that is not something that is a negative. And then most of you guys have been in school for many, 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 many years consistently. So giving your brain an academic break could be useful. And just reviewing once again, this is the competitive pre-health applicant. It is a lot of kind of aspects of your application that it takes to become competitive, but I want to encourage each and every one of you to take advantage of the resources on your individual campuses. If you do have a pre-health advising office, making sure that you're sitting down with them and reviewing your profile, making sure that you are a strong applicant, and if there are areas that you need to improve, finding resources to get into volunteering, finding resources to get into research, finding a mentor to connect with to get into these opportunities. Um, Definitely making sure that you're taking advantage of the resources that are available to you at your respective institution will be key in making sure that you become a competitive applicant. Okay, so I'm going to skip through this a little bit because we are running low on time, and I want to make sure that you all answer questions or ask questions that you may have. So I want to remind you that quality over quantity when you're applying. You must you must prepare for school, but also prepare for the profession. So preparing for school is really completing all those minimum requirements we talked about, but really preparing for your profession is exploring health career options, understanding and appreciating a variety of healthcare professions, exposing yourself to a variety of healthcare environments in a meaningful way, attend info sessions, open houses, join clubs, meet and connect with program representatives, develop your leadership experience, develop meaningful ongoing relationships with peers and mentors, and continue involvement with meaningful activities. What you should do should really reflect who you are as an individual. Okay, and that's really the end. Education is the most powerful weapon which you can use to change the world. And if you want to change the world, keep going, keep seeking. If you are interested in getting information about UC Prime pre-health pathways, you can join our listserv here. And you can also follow us on Instagram. We are building our social media presence and really trying to provide a resource for students via Instagram. I can also drop the link to our mailing list in the chat if you don't have a moment to scan that. And now, Twan, I'm not sure how you want to manage the questions, but I am open to questions and reflections. I'm not sure if the Q&A is active, but I'm going to go ahead and stop sharing so that we can have a couple moments for Q&A.
Hey, Lena, what I was able to do was compile a good number of the questions that I was able to see on the
Perfect.
chat. So you
Excellent.
look under questions, okay? And also please know that we can run about 5 minutes over or so,
Okay.
okay? So the next
Okay,
session
perfect.
doesn't really start until half an hour from now.
Oh, excellent. Okay.
So just look at the chat and then you could see
Okay.
about 7 or 8 questions all in one set.
Okay, let's see. Let me go to the bottom. Let's see. Okay, perfect. So let's start with this first question. Let's see. Can you please discuss an option or pathway for someone who has undergrad from a foreign country? Undergrad from a foreign country. So I would imagine that you may be at a community college. So I think that is the first step is starting to establish your educational foundation here at the community college here. Um, I think that's kind of a difficult question because I'm not sure what health profession you're interested in going into. Because there are some health professions where they will take a foreign undergraduate degree or assess them into their program, and you would only have to take a certain number of health profession um, prerequisites here. What I would suggest for that particular student that's asking is look into your programs that you're interested in applying to and talk to those recruiters directly. So typically, how are they assessing students with foreign degrees? Do they even assess students with foreign degrees? And if they do, is there some type of uh, combination of your foreign degree and additional courses you can take to make yourself applicable to that program? Let's see. I hope that answers that question. I'll move on to the next one. Um, do medical schools want specific volunteering at a hospital, or can other community services count as well? So, with medical schools in particular, and I know you have a few medical schools on track to present today. I know they can give very specific examples, but for the most part, when thinking about volunteering, the purpose of volunteering is for you to understand the healthcare environment and how healthcare professionals work in that environment. So it's not necessarily as important what you're doing, but not important where you do your volunteering, but it's that you are getting patient care experience, number one. So you are getting experience in yourself, you're putting yourself in an environment in which you are caring for others or taking care of patients so that you can understand yourself in that environment. And number two, you need to get in an opportunity with the objective of observing and understanding health careers. So are you in a space where you're working with physicians and seeing what physicians do and seeing what nurses do and seeing what PAs do and seeing what physical therapists or pharmacists do as it relates to other healthcare professionals and how they operate in the healthcare environment? So there is no specific place that you need to volunteer, but you need to have patient contact and exposure to healthcare professions in a meaningful way. So whatever way you can do that, that's what is the most important. Um, so you may serve as maybe you're a community health care navigator. So you might not necessarily be volunteering your time, but you may be getting paid, but you're getting patient care experience. And then you're also getting exposure to different healthcare professionals in a meaningful way. Just because it's not volunteering doesn't mean it still won't count for that patient care experience. At the end of the day, they say volunteering because they want you to expose yourself into healthcare before you get into these graduate programs. They want to see that you have done the proper research and understood what you're getting into. And that's what those experience should express in your application. Let's see. The next question is, what are examples of healthcare related experiences prior to graduate school? Volunteering in a hospital, volunteering in a hospice, working as a healthcare navigator. Let's see, any type of patient care experience. Some students decide to get jobs as a medical assistant or MA or uh, the CNA, a clinical nurse assistant. So are all experiences in which you can get that patient care experience and really, again, understand yourself as it relates to caring for patients and understand the health careers and what they are doing within it. Let's see. The next one is, can you recommend test prep programs? So I won't recommend any particular test prep programs because I think there are many out there, and students must figure out for themselves what area in within test prep that they need. So I found with my students that students have individual preferences. So some really like one, and another student will really detest that same test prep because they really needed the they really needed the test prep strategies, and that particular program doesn't really focus on test prep strategies. They really focus on content. And so I encourage students to really kind of do that research themselves and what test prep programs are out there, and then kind of see based on your initial diagnostics what you need so you can figure out what test prep program provides all that you need as a preparing applicant. Let's see. Okay, so a question here, does UC Irvine stand out from other UCs in Southern California in terms of its Prime Scholar program? So thank you for asking that question. So UC Irvine is actually a pioneer in the Prime program because the Prime program originated with the School of Medicine, and it stands for Programs in Medical Education. So the original Prime program was really structured um, to bring equity into medicine, into the physician program. And so UC Irvine is a pioneer in that way. And UC Irvine is now a pioneer in bringing that same objective to the undergraduate, and then also diversifying healthcare overall. So we're no longer just focusing on physician diversification, we're really focusing on diversifying healthcare as a whole. And so we're still prime, but we're pre-health. So we're really focusing on equity within all health professions, not just the physician career. So within that, UCI does stand out with our premier UC Prime Pre-Health Pathways program. We are hoping that it does spread to other UCs as a pre-health program, but we are a premier program within the UC, so it is pretty special. The next question is, how does one get clinical experience? And then Tuan, if you want to jump in, any comments or anything, let me know. So how does one get clinical experience during second year without a certification or degree? So there are actually volunteer programs. So there's a lot of ways that you can start getting clinical experience, and really starting with volunteering is a way to kind of start developing your resume. Volunteering, you can get that by starting out with volunteering organizations like Cope Health Scholar. So Cope Health Scholar is a volunteer organization that really sets students up for success because they do a structured training. They provide you a certificate at the end of your volunteer opportunity, and they are very intentional about exposing volunteers to various areas within the hospital. So they have like a tiered structure to make sure that you hit every the OR, the ER, the different areas within the hospital. So you get a well-rounded exposure in a volunteer experience. So within COPE, you can even get healthcare management experience. I can make sure that I drop, or if anyone from Twan's team has access to the Cope Health Scholar General link, I would ask if you guys can drop that link in the chat, because that's a great program for any student to be a part of to get an initial exposure into volunteering in healthcare. And then whatever, if you have a local hospital in your area, or a hospice or a clinic, it is okay to look at their website or even go in and say, hey, I'm interested in getting healthcare experience. Do you have any opportunities for volunteering? I would encourage you, I know as first gen marginalized, we don't know to ask those questions, but the worst thing you can get is a no. So make sure that you ask. If you have a hospital that's right next to your school or right next to your home, and you say it'd be really convenient to volunteer there, go in and ask, what is the volunteering process? Do you have a volunteer coordinator or volunteer department that I can talk to see what the process is to be able to volunteer here at this hospice clinic or area? I hope that helps. A lot of times when you have that volunteer experience, it makes it a little bit um, easier to get into those to get those MA certificates or CNA certificates. Let's see. There is a question that I think also you should bring to the medical school panel, but there is a question being asked, would medical schools have a bias against students from CSU versus UC, or would good test scores and high GPA offset that? So what I didn't share is that prior to being at UC Irvine, I was actually the health professions coordinator at Cal State Long Beach for 7 years. So CSU has a special place in my heart, and CSU students are just as competitive as the UC students. And it may seem that UC students get in at a higher rate, but the reality is there are tremendously more UC students applying to medical school than there are CSU students. And in my 7 years of pre-health advising at the CSU, my students that were applying and had the GPA and the MCAT score, they were getting in just as much or higher rates, high rates just as the UCs. Prior to working at Cal State Long Beach, I actually worked at a private school. I worked at USC, and working as a pre-health advisor at USC, the same thing. So they are not getting in at higher rates. They're applying at higher rates. But those students that are equivalent, so CSU private UC students that are equivalent in MCAT and GPA, those three applicants, they're going to be looked at the same level. No one is going to be chosen purely off of the name on your degree. So I would highly encourage you, if you're thinking about the programs that you're transferring to, the title on your degree actually has a lot less bearing than a lot of students really think. It's really about who you are and what you have done with your profile. So if you go to a USC and do the bare minimum and don't really have, aren't really showing who you are as an individual and submit a really generic application, you're probably not going to be as successful as the CSU student that is very well rounded and has been very involved in the community, has shown their passion for health equity or whatever their passion is, and continue to do the things that make them an individual. So I just want to encourage you all that the application process is made to assess students about of who they are, not necessarily the title on your degree. So please know that there is no value of one or the other. And when you see those numbers, it's really because UC students are, many more UC students are applying to medical, dental, pharmacy programs than CSU students. So I encourage you, you will be competitive no matter what. If you make your individual competitive application, you will be just as in the same pool as those other students that are applying. Let's see. I'm going to scroll down to the bottom to see if we have other questions. Okay, there's a question about where does med school align with this pathway? Is it grad school or residency or grad school plus? So medical school is graduate school. And that's why I did show that that's why I did show that slide with the different programs, because some students aren't clear on the fact that medical school is graduate school and it's 4 years, and you're not actually working right after graduate school. You do have another portion of your education before you actually get into your career. So that's what I wanted to kind of clarify with that. How many more questions do we want to get through, Tuan?
We probably don't have too much time for any more questions, but if you don't mind, if you could allow me to ask a question that was posed earlier, okay?
Yes, yes.
Community college students, for some of the prerequisite courses, the bios, the chems, and so forth, should they take it at the community college? Should they take it at the university? Should they take it, maybe after they graduate? When's probably a good time to take it?
That's a great question. The prerequisites. So you said when is a good time to take it, or is it okay to take it at a community college?
Sort of
Which
both, honestly.
Okay. So number one, when you take it, that's on a personal so when you take it, it depends on where you are. Let's start off with if it's okay. So that's this question that I get very often. And to kind of give you the answer, over the years, I've had many health profession panels, and a lot of times I like to have a variety of individuals on the panel, and we'll talk about their educational career. And many of my panelists that I have that are currently practicing physicians or pharmacists or dentists started off at a community college. And so that means a lot of their prerequisites, the chemistries, the bios, the physics, were done at community college first, and they still got into medical school, they still got into dental school, they still got into pharmacy school. What I'm saying is that we have so many students that are transfer students to UCI. We have so many students that transferred to Cal State Long Beach when I was there, so many students that transferred to USC when I was there. And it didn't keep them from getting into their next step. Being a transfer student is not a detriment. The only thing you want to keep in mind is that there's no huge inconsistency between your community college coursework and your 4-year university coursework. And then you want all your upper division coursework to be at that 4-year institution. And typically, that's where you're going to find your microbiologies, your biochemistries, and things like that. So you want to have the majority of your coursework in your upper division coursework at a 4-year institution, but it's totally fine to have the kind of first 2-year prerequisite courses done at a community college. That is okay because I have students over and over again, or graduate students or professionals that have made it through and are in their career and they started at community college.